all of your energy against this, which just seems apparent. The other thing that they do is some of them will do things like they cut themselves, and they cut themselves sometimes severely, and maybe 5 or 10 or 20% of their brain says, yeah, I'm going to kill myself. But when they make this a suicide attempt, it stops the attack. And then they think, okay, now the attack is gone, I feel okay. Then they think, okay, now I go to the emergency room, the doctor says, what happened? You say, well, I cut myself. Were you thinking of killing yourself? Yeah, I was. Okay, so we need to make the stitches. But the doctors don't realize how this happened. It happened in the opposite order of one of my patients. There's a typical example describing exactly what this experience is like. And basically saying, the doctors have misunderstood. I have told hundreds of doctors this, but they think I'm an impulsive person. And I asked her on the tape, well, are you an impulsive person? She said, no, I'm less impulsive than you are. I'm the opposite. Everything I plan very carefully. I don't do anything without thinking about it ahead of time. I never take risks in my life. She was less impulsive than an average person. The issue is this, that people, every psychiatrist has seen many patients who have made sudden impulsive suicide attempts. So they always assume that all of these patients are impulsive people with impulsive traits. Yeah, if you ask 99% of the psychiatrists in this Congress, that's what they believe. But it's not true. They've been doing studies for almost 20 years looking at the association of impulsive traits and suicide. And almost all of these studies have not found the association. One or two of them said, oh yeah, we found an association between the two, but when you look in the paper at the data says the opposite. Okay, so they say, oh, well, these two things are important. And I say, well, what about these other 22 things? In the same paper, they say there's no effect. But most of the papers say there's no effect at all.